one of the things I hear in the medical community is that there was a recent article written, it's hyperbaric oxygen, hope or hype. Okay.
I read that article.
Yeah.
I did.
And so to me, it's unfortunate that someone might focus on the negative, because I felt like it did.
It did.
The one thing about the case studies, because it's not a peer-reviewed clinical trial with a placebo.
Right.
And one of the infighting things that has happened in the hyperbaric community is, what is a placebo? Okay.
Right.
So how do you have a sham, right?
Right.
Which to me, looking at all the shams in the studies, they're going to 1.3 atmospheres, which is hyperbaric.
Right.
Now they're not doing the oxygen, but it's still hyperbaric, and you're still
pressure.
driving the 21%
Right.
oxygen available into the plasma,
Right.
which is stimulating the genes,
Right.
which we all know about. So that to me, case studies can't be ignored. And even though it's not a peer-reviewed, now there are plenty of peer-reviewed case studies, but generally, to me, they're almost set up for the argument of, is this really a sham or a placebo of
Right.
this group? Because a lot of studies are thrown out or saying that hyperbaric doesn't matter because both groups got better.
Right.
And so that's one of the issues that
Right.
that we deal with reading those studies, and
Right.
that's why we do the research rundowns. Is like, okay, they're saying it's not really making a difference
Right.
because both groups got better. I'm sorry, I have a problem with that.
Right. Well, study design is critical. How did you design your study? How are you measuring your placebo? That's why diving into the details of any study is really important to evaluating it. Just reading the headline, which unfortunately people read the headlines, right? But if you're just reading the headline, you're not getting the meat. The design of the study is critical to really being able to assess efficacy and safety. Yeah.
Yeah. So I think it's important for us to even allow and focus on some case studies. Just get people in that tell their story and say, look, I tried everything, or I tried this, and here's what I did.
Yeah.
And we're so blessed to have you here because of your background.
Yeah.
Because you really understand a lot of the science that's going on, and you are already dealing with Lyme disease, which is very similar to any autoimmune disease, where you have this inflammatory thing going on. It's affecting you in lots of areas.
Oh, yes.
And so
Absolutely.
I will tell you one story about somebody with Lyme disease that I met.
Yeah.
It was one of the administrators running Patriot clinics in Tulsa, Oklahoma, and and Patriot Clinics in Tulsa, they treated some 500 veterans with PTSD with donated money, donated chambers, and healed them. These most of them war fighters were in a bedroom locked in the dark for years and years, like 7-10 years. And then they found Patriot Clinics, and they got 40 treatments, and then they got their executive function back.
Amazing.
Some of them starting businesses. I saw videos of guys, in the car on their way to the clinic from the first day to the 40th day, talking about their experience. It was just amazing. And to me, those were were all case studies.
Yeah.
So there wasn't some combined study about that, but 500 souls were saved that didn't commit suicide, that worked their way out of it. And anyhow, so the administrator had Lyme disease, and she said she had it for 20 years. Her skin was becoming transparent. It was so bad, and that she was told to get her affairs in order and all of this. And I met her. She didn't look anything like that. She looked normal, because she found hyperbaric oxygen. And it instantly turned her around. And so she was working in the clinic and continuing to get treatments. And I don't know how many she got, but she got, I'm sure north of 40, which was for PTSD. So she kept doing it. And so if Lyme disease was one actually specific thing, it may be a spectrum. I don't know. Not all bugs are the same, and there's feline disease, and there's all these other things that they can be confused with it. You don't really know 100%.
It's very confusing. It is. It's a tough one. It's a tough one to treat.
So symptoms are not all the same for everybody.
They're not all the same. Yeah.
But that's what they diagnosed her with, and it was so severe. And so she was just volunteering, and she's working in this clinic for free. And they saved her life. And anyhow, so.
But to your point about dose, I was just kind of thinking through this, that it does for the patient, it does help. Like, it does help wrap your brain around something, you know. So, for example, when my Lyme doctor wanted me to do hyperbaric, and I remember saying, well, for how long? And like help me wrap my brain around what, and there was no answer, right? But for the patient who's budgeting and trying to understand like what kind of commitment this is, and you know, and when can I expect to start feeling better and all that kind of thing, it does make a difference. It definitely makes a difference, and then it becomes, you know, especially in the work that I do, you know, it's kind of very protocol driven. Like, you know, you're treating this disease and you treat it for this long at this dose, you know, and it's different for another disease, this long at this dose, and it gives a sense, it gives a clinicalness, you know, kind of a little bit of validity to, you know, we have studied it in this patient population, and we know that it's at this level, 40 dives, like we know with PTSD, that you really start seeing a turnaround. So I think the value that would bring to the science is really there.
The dose,
for sure. Yeah, the dose. Absolutely.
And it would be great if, you know, if it was funded, or there was any money in this whole, you know, this whole thing. And you know, this is the interesting thing that I learned, and it's secret. Maybe I shouldn't let it out, but I will let it out. Is that for the 80 minutes you were in there breathing oxygen, and I don't know if they did the hypoxic switch, but usually there's an air break, and so your body thinks it's suffocating with air because it detects the oxygen level dropped tremendously, and then you turn it back on. So you basically kind of get two treatments out of one, you know. So they're at least doing that at a minimum, and so the oxygen that you breathe was FDA approved, you know, whatever, cleared, you know. It's really more of a sanitation purity thing, test to make sure that's what that is. Costs less than $1. It's less than $1. Now that's in bulk, and that's liquid, and that's, you know, and that's turned in, but still, it's not expensive.
No.
I guess the complex part of it is to put a human being in a pressure chamber. Right. That's more of that's the art.
Right.
And how to do it safely, and how to put them in there with pure oxygen, and not, you know, create an environment where they're the fuel.
Right.
Because, you know, you got ignition, oxygen, fuel, right? And so, and I know the multi-chambers, which I happen to be a big fan of. Yeah. Number one, you're in there with a group.
Yes.
And so the air environment that you're sitting in is OSHA. It's below the oxygen level, I should say, is below the number OSHA would allow for a job site, where you might have people smoking. Right. And the only pure oxygen that's being delivered there is individually through a hood or a mask. Right. And so the challenge in that environment is, what is the dose?
Right.
So we actually developed this spreadsheet. It's a very sophisticated spreadsheet to determine what is your dose. So we could plug in, you know, when the oxygen turned on, what is the pressure? Because it's a pressure oxygen thing. So something you could talk with the nurse practitioner at Extavita, Elena. She's very familiar with that chart. That I really wanted to understand what is the dose, and how do we calculate under this curve, you know, through some basic calculus. What's the dose under the curve, you know? And it's stepping throughout, because pressure is changing as you come to your depth. Which generally is 2 atmospheres, or a 33-foot scuba dive, right? So that we could at least understand what the dose is when someone says, "Hey, try this protocol." We understand, is it a different dose, less, more, you know, that sort of thing. And so I just feel like, and I would say it's not a complete consensus, but there's a lot of doctors that have been in this a long time that you know, they I wouldn't say they're frustrated, but they wish the industry was focused on dose and not just survival, right?
Makes sense. Yeah, for sure. I mean, you know, that's so much of the work that we do on you know, on our side of drug development is that area under the curve is critical. The therapeutic index, you know, when are you below it? When are you above it? When are you in the sweet spot? So quantifying that would be very, very valuable for sure, in terms of, again, adding kind of like the validity, the science behind being able to really tailor like to this disease, that disease, or this whatever, this particular patient and how they're presenting. So I absolutely see value if there's a way to evaluate that. I see tremendous value in advancing, because as a scientist and as someone that's in drug development, that's what I look for. That's what I'm looking for. Well, what's your area under the curve? Where do you know that you're at the therapeutic index? How do you know you're at the therapeutic index?
Oh, interesting. Yeah.
And how long are you at the therapeutic index? Like, do we want you in the therapeutic window for an hour, 10 hours? And so then it becomes a half-life. So when you pull off of the hyperbaric, when does your next dose need to come for it to be the most valuable, right? So say you do a session today, should you wait 2 days? Should you come tomorrow? Like what gives you the biggest bang for your buck in terms of what we call, the therapeutic window, and keeping, because you want to, if I apply this to drugs, like with the drug, we would want to keep the level. Generally, we try to keep the level of a drug in the blood inside the therapeutic index, right? So sometimes, depending on the half-life of a drug, you can be in your therapeutic index by taking it once a day. You just trickle up and down in between that therapeutic index, right? Some drugs have a shorter half-life, and you have to take it twice a day to stay in that therapeutic index. So what keeps you in whatever is the defined therapeutic index, if that can be translated to oxygen therapy? Is it daily? Is it twice a day? Because I know sometimes when people are traveling, just because I've talked to so many people in the hyperbaric chamber, that they'll tell me I'm from Florida, and so I'm doing 2 today, 2 tomorrow, and then 1 the next day, so I can get home, and then I'll come back next week and do the same thing. What does that mean for their therapeutic index, their therapeutic window? Does that make sense?
Yeah, totally. I think maybe 20 years from now they'll be looking back, and if they were to listen to this conversation that we're having right now, they're saying, "Are you kidding me? They weren't thinking about that back then." They were just starting to discuss it, because right now, if there's any discussion, it's really about separating the pressure from the oxygen as what is hyperbaric oxygen.
Right.
The industry can't even come together and decide what hyperbaric oxygen is, quite frankly, much less all these variables that you're talking about, where the drug industry is so developed, into honing in on something very specific.
Right.
Not that they're hitting the target,
right.
But they're just trying to find the target.
Right.
And so,
right.
and they can't look at all the variables, because it might be, you're smaller than me, you're larger than me, you're older than me, you're younger. So there's so many variables that are in there. Yeah, wouldn't it be great someday we would just put you in a scanner and say, okay, this is what you need, this is the dose, this is everything you need, and go on.
And per level of inflammation, is that a factor? Like, can we determine, there's measurements for inflammation in your body? Is that a factor? Do you look at how much inflammation somebody has, and then that also dictates, what dose you need and for how long? I don't know. It's just something to think about.
Well, you certainly opened my eyes and gave me a new buzzword, therapeutic index. I like it. Thank you so much, Laurie, for joining me today.
Thank you for having me. I'm a big believer, and when I have the opportunity, when I get asked about HBOT, just among my friends and family, or friends of friends, I'll have friends of friends people will send them to me, and I'm always like, it is worth a try. They'll tell me what's going on with them, and I'll be like, you know what? I hear you. I know what you've been through. I've been there, and it is worth a try, because this is my story, and it was a game changer. So after everything you've been through, it's worth a try to give it a shot and see what it can do for you.
Well, thank you. God bless you for coming in and speaking to us.
Thank you for having me.
Thank you.
Yes.
Bye now.